along. I've been joined by Minister Pakula in his capacity as Industry Support Minister, amongst a range of others, and Deputy Secretary Kate Matson from the Department of Health to provide today's coronavirus update to the Victorian community. There were 65 local cases reported in today's numbers, 16 of which we announced yesterday linked to the Shepparton cases. Kate will go through those links in more detail shortly. 55 are linked to known outbreaks. 10 cases have their acquisition source under investigation, and 12 were in isolation for the entirety of their infectious period. I can also advise another case reported overnight, but not in this morning's numbers, has come in from the Mansfield area, and it too is linked to the Shepparton cases. There are now some 440 active coronavirus cases in Victoria. 27 people are now in hospital. That's a significant jump from where we were in recent days. 12 of those 27 are in ICU and 5 are on a ventilator, and we send our best wishes and support to all of those people who are struggling with this virus. There were 44,147 tests processed yesterday for the COVID-19 virus, and there were also 26,149 vaccinations in our state-run centres, quite a high number for a Saturday, and continuing a very solid list of vaccination levels both in our state-run clinics and in the wider public health sector, primary health sector rather, over past weeks as more and more Victorians get on board and support vaccinations as our passport towards hope and getting out of this vaccine, this COVID-19 pandemic. In fact, more than 2% of Victorians were vaccinated on Thursday and Friday of last week. There are still lots of vaccination appointments available in the coming week as more stock becomes available. There are some 62,894 vaccine appointments available next week. This includes more than 5,000 at the Ford factory in Geelong, almost 1,000 at Wodonga, more than 1,600 in Shepparton, and more than 2,500 in Warrnambool, more than 3,000 at the Sandown vaccination clinic, more than 4,000 across a range of locations in Melton, and more than 4,000 at the Melbourne Convention and Exhibition Centre. And there's 1,500 available at the Frankston Bayside Centre. So please get on board the growing number of Victorians who are eligible and are getting the best vaccine that's available. That is the one that is available now. That vaccination journey is our quickest way out of this pandemic, together with driving down our infection levels. I'll have a few words more to say on other measures that we're taking to support vaccination levels and support for particular groups, and some issues in some of our health services. I'll then hand over to Minister Pakula and, in turn, Deputy Secretary Matson. So first, it's not just the increased numbers of cases of people who are ill with coronavirus in our hospitals that is a matter of concern. It shows the impact of large coronavirus outbreaks can have on our health system more generally. And that's why I want to particularly commend the Royal Melbourne Hospital for their efforts in protecting both their workforce and their patients, including an extraordinary response since they've detected cases in their visitors and their patients and into their staff group as well. The same, of course, also applies to Werribee Mercy, which was the subject of our report yesterday, and Kate will have more to say about those. We're continuing to work through the impacts of both those exposures in those two health settings and what it means for furloughing substantial numbers of our healthcare workers and the impact on patient care, all around making sure that the systems we have in place to escalate the COVID response and to continue our health services in the safest possible way continues throughout our response to this outbreak. In regards to further measures to support vaccination ramp up, I've got a couple of announcements to make as well. So the Victorian Government is today putting in place systems that will offer all public sector employees access to a half a day's paid time off to each dose of the vaccine they receive. We've been working with a number of other larger private sector employers who have put in place similar arrangements, and we think it's the responsibility of us as a significant employer in the state to put in place all the support we can to encourage our employees to get on and make sure that they are all vaccinated as soon as possible. In addition to our already high numbers of vaccines, whether it be for nurses, AMBOs, police, firefighters and others, this obviously picks up those groups, but it also picks up all public sector and related agencies right across our state. This is a part of our drive to make sure that we administer 1 million doses of the vaccines that are available from the 16th of August. More than 500,000 doses have already been delivered this month across the state, and I'm confident that with the growing momentum and the growing sense of vaccines are so critical to our pathway out of this pandemic, that public sector employees and the workforce more generally and Victorians everywhere will step up in increasing numbers and grab those vaccines that are available now and will become in increasing supply over coming weeks and months. The new arrangements for the Victorian state public sector apply to all full-time and part-time staff and to long-term and regular casuals, whether they be departmental, administrative, statutory authorities, government schools, TAFEs, police, emergency services, water authorities, land management authorities, and all public entities. All public sector workers are strongly encouraged to come forward and get vaccinated as soon as you're eligible, knowing that substantial numbers already have. There is more to be done here, and we are confident that the support will encourage, as they have in private sector employer arrangements, give our employees more confidence and support to get vaccinated. The paid time off to get vaccinated applies in addition to accrued sick leave, which can be used if people do expect in a small number of cases some adverse side effects. The second measure that I'm announcing today to further encourage vaccinations is for another aged care workforce blitz. We know that residential aged care and disability workforces are so critical to protecting our most vulnerable citizens and community members from COVID-19. Residential aged care and disability workers will be able to walk up in one of more than 50 vaccination centres that the state runs across Victoria and to get vaccinated with the vaccine of their choice, regardless of their age. This runs from Monday to Sunday of the coming week. So tomorrow and for the next week, all residential aged care workforce and all disability workforce members who are not vaccinated come forward and get vaccinated. Not only we have the ability to walk up to those more than 50 state-run centres, we would encourage you, if you want to book through and get priority booking status on the online appointment system. Staff can demonstrate their eligibility by showing their residential aged care or disability staff identification card. All these vaccines are free, they're available to everyone. You don't need your Medicare card to access the vaccine, but what you do, of course, want to do is to play your part in getting us to the other side of this pandemic. And we've introduced that measure. We did a blitz a while ago, but we've reintroduced this measure for residential aged care staff because all private and residential aged care workers in Australia are required to receive their first vaccination by September the 17th as a condition of their employment. This is what has been mandated by National Cabinet and which various orders around the Commonwealth will be in place to require all private and public sector residential aged care workers to be vaccinated with at least the first vaccine by September the 17th. The majority, the very strong majority of Victoria's public residential aged care staff in Victoria have already received at least one dose of COVID-19. The figures from the week just gone have seen us at over 81% of our public residential aged care staff have received that first vaccine, and a majority of those, of course, have also had their second vaccine. We just need those remainers to come forward and get vaccinated as soon as possible. They are, in fact, amongst our most vaccinated workforce groups in the state, in the public sector. There is still more to do in the private residential aged care sector, and that's why we're helping the Commonwealth in their responsibility of delivering this, Commonwealth being the funder, the regulator, the oversight of private residential aged care sector, but there is still substantial more work to do. But I'm confident that the partnership between the Commonwealth and the state will see these national targets met in Victoria. Finally, the new drive-through centre for vaccines at the Ford factory in Broadmeadows has a soft launch today for targeted groups just to knock out any bugs that might be in the system and the learnings from Melton, and that centre will be available tomorrow. Just don't drive up, you need to book, but that drive-through vaccination centre will be available as of tomorrow for bookings. That centre will join Melton, Sandown and the Eagles Stadium in Werribee as Australia's first drive-through vaccination centres. I'll ask Minister Pakula to update on business support, then Deputy Secretary Matson on some of the details behind today's numbers, and then we're happy to take questions.
Thanks, Marty. When on Thursday the government announced an $807 million jointly funded package with the Commonwealth for metropolitan businesses and for those regional businesses that were applicants to the Small Business Hardship Fund. Today I'm announcing an additional $146.6 million to support up to 20,000 additional regional businesses through both the Business Cost Assistance Program and the Licensed Hospitality Venue Fund, and another round of support payments for alpine businesses. We welcome the Commonwealth having again made a 50% contribution to that package, and that ongoing partnership with the Commonwealth during this very difficult period allows us to do what we're doing at the moment in terms of supporting those businesses. So The details of that package are that the Business Cost Assistance Program, like the Metropolitan Program, will have payments of $2,800 a week, so $5,600 between now and the 2nd of September. So we're not, the fact that it's slightly less than 2 weeks is immaterial. That is $100.9 million to around 18,000 businesses, non-essential retailers, event businesses, cafes, accommodation providers, some restaurants, gyms, hairdressers, nail salons, swim schools, all of the same types of businesses that are supported through the Metropolitan BCAP. The Licensed Hospitality Venue Fund is $34.5 million, will support about 2,000 businesses. And again, like the Metropolitan payment, that is a tiered payment of $5,000, $10,000 or $20,000 per week based on patronage capacity. And again, as we've done in the past, an Alpine Resorts Winter Support Program in recognition of the fact that the earning period for Alpine businesses is much, much shorter than it is for businesses in other parts of the economy. And so that's $11.2 million in total, $5,000 per week to off-mountain Alpine industry businesses, $10,000 per week to on-mountain non-employing businesses, and $20,000 per week to on-mountain employing businesses. The Commonwealth disaster payment is also being extended to regional Victoria, and that is in identical terms as for Metropolitan Melbourne. So for sole trader businesses who don't qualify for Victorian government payments, and indeed for individuals, $450 per week for 8 to 20 hours lost, and $750 per week for over 20 hours lost, and a $200 payment for those people who are on other types of Commonwealth income support, and that's administered through Services Australia. So that takes the total support over this 2-week period between Metropolitan Melbourne and regional Victoria to a shade over $950 million. We have spent now over $9 billion since the start of this pandemic in business support, and it is a continuation of the government's commitment now in collaboration with the Commonwealth to continue to support business until we get to those, until we get through this lockdown, and indeed as needed until we get those magic numbers of vaccinations that we're all striving for. With those few words, I'll hand over to Kate, and as Minister Foley said, we'll then take questions.
Thank you, Minister, and good morning. Of today's 65 local cases, 21 are linked to the Greater Shepparton community outbreak, and we discussed 17 of those yesterday, although they're in today's official numbers. 8 are linked to Altaqua College. 8 are linked to the City of Hobsons Bay outbreak. 5 are linked to the My Centre Childcare Broadmeadows outbreak. 13 are linked to general other outbreaks, including St Kilda, CS Square and so forth. And 10 cases are not yet linked to known outbreaks. We have more than 11,000 primary close contacts and 9,000 secondary close contacts. 103 of our 440 active cases are aged below 9, and I'll come back to that in a moment. Our contact tracing teams, our local public health units, our Central Department of Health, our testing teams on the ground, our pathology teams are driving as hard as they can to get on top of this situation. We listed over 100 exposure sites yesterday alone, and although we only have 12 cases who are in full isolation throughout their infectious period, 44 of the cases we're announcing today were linked as primary close contacts to confirmed cases. We have a number of cases in public housing settings, and we've built a strong response across those settings to support those residents and ensure we have communication and testing supports to those buildings. We are testing the whole building as we have a new case identified in that building, as well as continuing with our response to Tier 1 and isolate for 14 days anyone on the same floor as a confirmed case. As I mentioned, 10 of today's new cases are in the Hobsons Bay LGA. We're still very concerned about transmission in Newport, Altona North and related suburbs. We remind everyone, please, get tested if you experience symptoms. We are continuing to see impacts both in those areas but across Melbourne, and also now in the regional areas where people are not getting tested as soon as they experience symptoms. Our teams are working as hard as they possibly can to get on top of this. Victorians can work equally as hard by getting tested as soon as you've got a slight sniffle, gastro symptoms, a headache is a symptom of coronavirus. Please come forward and get tested. This is community transmission. This is not isolated to one area of Melbourne, and our wastewater detections continue to show that. We have wastewater detections in the northern suburbs, Coburg through to Thomastown, and if you were in those areas from the 15th to 20th of August and you're experiencing symptoms, again, please, this message is for you. Bayside, Brighton to Black Rock, again, wastewater detections in those suburbs related to the 16th to the 19th of August. In the western suburbs, in the residential areas of Sunshine to West Footscray, again, period of interest 15th to the 20th of August. And we've raised the industrial area in Sunshine West before. We're continuing to see detections, daily detections in that area. So we've had daily detections and no known case related to that area dating back to the 8th of August, continued detections through to the 20th of August. Again, if you live in that area, I beg your pardon, no one lives in that area. If you work in that area and you haven't yet been tested, please do so. We know there's a lot of demand for testing in Shepparton. We have 5 sites operating in and around the area, and we've doubled drive-through capacity for testing today by opening a new site at the showgrounds. Yesterday, we conducted more than 2,000 tests in Shepparton alone. As I mentioned, we're now seeing community transmission. We have cases in Shepparton, we have cases in Richmond, Newport, Frankston, St Kilda, Brunswick, North Melbourne. I ask everyone to consider that COVID may be out there as you go for your 1 hour of exercise, as you collect your groceries, when you pick up your takeaway coffee, if you get Uber Eats delivered to your door. We have community transmission. Please maintain the same behaviours and the vigilance that we've been practising over the last 18 months. This is represented by having cases present at a number of our healthcare settings. Minister Foley mentioned an additional case, not in today's numbers, who presented at Mansfield Emergency Department overnight. We've had a case, as we all know, in the Royal Melbourne Hospital. That case wasn't there for COVID symptoms and wasn't showing COVID symptoms when they underwent surgery on the 12th of August. Symptoms commenced the next day. In the cases announced today, there are 3 cases related to the Royal Melbourne Hospital outbreak. There was a case yesterday, and we'll be announcing a further 3 cases tomorrow related to Royal Melbourne. We expect that outbreak to grow, just as we expect the Shepparton outbreak to grow. There's a number of patients and staff, as well as a visit to the hospital. And again, I thank the Royal Melbourne and all our health services for continuing to drive that down, do the contact tracing and manage the staff situation. Our contact tracing teams are working extremely hard to manage the downstream transmission risk. Identification of primary close contacts is more important as ever, and again, getting tested and isolating if the department or our local public health units ask you to do that is extremely important. The last message today is around the nature of this outbreak. We continue to see cases in younger people. We have 259 of our active cases in people aged under 30. I remember being under 30, although I'm not going to pretend that I understand exactly how people in that age group communicate. And if you've got TikTok on your phone, if you've got Snapchat on your phone, if you have Binge on your phone, if you do online gaming, feel free to make a GIF or a meme of something I'm saying. But my message to everyone in that youth group is please isolate, minimise transmission, communicate with your friends through your phone, through online, through phone calls, but please don't catch up together until we get out of this. That is my message to you today. We haven't seen outbreak transmission in this youth cohort like we're seeing currently, and I urge you, please, help us to get on top of this. I'll pass back to Minister Foley for questions.
Minister,
Thanks,
Kate
Kate.
has given us an incredible amount of detail there. I'd love to be corrected, but what that says to me is that this outbreak is getting away from us.
What this shows is that we've got community transmission. We're still in the realm of hauling this back. Our public health team are confident that when you've looked at the earlier parts of this outbreak, Altaqua College, some of those earlier parts of the shoulder of that part of the outbreak are under control. What we've seen is more cases pop up in areas, whether it be Shepparton, Mansfield, the Royal Melbourne and other parts of metropolitan Melbourne that are of great concern. That is why we extended the public health orders and restrictions statewide, and we are throwing everything at this with the support of our public health teams, our hard-working frontline healthcare professionals, and the overwhelming support of Victorians, because we are determined to do two things: drive down our infection rates and drive up our vaccination rates. That's how we'll get on top of this, and that's how we'll come out the other side.
Minister, was the person who underwent surgery at Royal Melbourne Hospital and subsequently tested positive for coronavirus, were they tested before the surgery?
I don't have that particular information, but what I do know is that they're not the index case, and that it was as a result of other forms of the infection coming in through visitors and those arrangements. So the person who was the subject of the case in surgery was doing totally the right thing, and I'm going to guess was tested, but let me get back to you on that particular issue.
Should the government have a policy of testing every person who undergoes surgery in a Victorian hospital for coronavirus prior to surgery?
Well, in terms of what we do, particularly in this COVID setting, pre-operative testing is part of those arrangements.
Is it mandatory, sorry?
Yes, it is, particularly as we've raised the level of risk over recent times.
Is that with a traditional coronavirus test, or is that a PCR test?
Well, the traditional coronavirus test is the PCR test.
Can we get a bit more information on the case?
I can't hear, sorry.
Sorry, I'm at the back as well. Can we get a bit more information on the Mansfield case?
Well, it just came in very late overnight. So someone presented at the emergency department in Mansfield, and as a result of the work of the Mansfield team, was identified as symptomatic, and the immediate link was made through presentation of information to the Shepparton community outbreak, and work was then undertaken to make sure that the person was treated appropriately, not in Mansfield, but in a more COVID-secure location.
Do you have
So that is literally overnight, very early hours of the morning, and there'll be more details coming in today around contact tracing and the links, and we'll provide more on that tomorrow.
I know I'm probably pushing my luck with asking for more detail, but do you know if there's any connection with the Alpine Resorts or Alpine regions? We've previously heard
that
their
data
hopes.
at the moment. Samaya.
Do you have a breakdown for the ages of people who are in hospital and ICU?
We can get you that. I don't have it here and now, but what we've seen, some of the data that was reported in recent days shows an increasing number of younger people in ICU, but we can certainly get you that particular breakdown.
Sorry, just to clarify, was that Mansfield case, did that person present to emergency with coronavirus symptoms, or were they there for another medical reason?
I don't have that exact detail, but they were identified by the staff as having symptoms. So whether that was the reason or whether it was a pre-existing condition, I don't have that detail at the moment.
Are you concerned that people who are vaccinated aren't turning out for testing because they might feel protected?
I don't have any evidence to that that's the fact. And given the huge turnout of people in recent times since we put the call, I would imagine that quite a substantial number of those are vaccinated, because we know that whilst vaccination is a very, very strong precondition for you not getting ill and certainly avoiding hospitalisation, there is still a low risk of you being able to acquire and to pass it on. So I would have thought anecdotally that quite a large number of people, regardless of their vaccination status, are coming forward to be tested.
Minister, but there are still plenty of appointments available, and at this stage it doesn't really matter which arm the vaccine goes into.
That's correct.
So given we know that it's going to be opened to 16 to 39-year-olds at the end of next week, or August 30, whenever that day is, did we at least consider maybe opening up our state-run appointments to all ages now, just to make sure those appointments are gobbled up?
Well, we're always reviewing how we go about expanding the vaccination coverage. It's all due to increasing demand and the constraints of supply. Supply is decreasingly a constraint. We are looking at all sorts of ways and means of how we can increase the vaccination levels. The Prime Minister's announcement the other day that from the 30th of August that all 16-year-olds and above would be eligible for vaccinations came as a bit of a surprise to all the states, but we're just working through what that means in terms of the commitment from supply from General Fruin. But I'm confident that if the Commonwealth's committed to that, that it will make sure we've got the supply to do that.
We're essentially paying people to go forward and get a vaccine at this point in time. It's an incentive to go get one. So before we get to this level, which you've announced today, wouldn't it have been an option to maybe open it up to those people who would just go get it anyway?
We are confident that with the call out to over 300,000 public sector employees, tens of thousands of residential aged care and disability workforce, and millions of Victorians, that the many, many thousands of slots that I've highlighted right across the state will be filled very quickly. What we want is more people coming forward as quickly as possible, and as soon as we are certain of the supply coming in, then we will throw open our doors, remembering, of course, that the majority of supply of vaccines continues to be through the primary healthcare system, our GPs, an increasing number of pharmacies, our community health sector and others, and both our state-run system and our primary healthcare system are all stepping up in increasing numbers. What we want is Victorians to come forward.
Is it are Victorians in that 40 to 60 age group a problem right now?
We want increasing numbers. So on Thursday and Friday, over 2% of Victoria's population got a jab. We've had one of the strongest weeks that we've ever had for vaccinations in the past week across all the platforms, state-run, primary health care, specialist in-reach programs, at-risk communities. And for those 2 days alone, 2% of Victorians, over 2% of Victorians, received a vaccination. That's great, but what we need to do is continue to lift that performance, and what we need is, as is increasingly the case, more points of distribution and more vaccine.
But to get to 80%, is demand too low at the moment between that 40 to 60 age group?
We will get to 80% because Victorians know it is the pathway to hope and recovery and a post-pandemic future. I am confident that we will get to 80%. We want to get there as soon as we possibly can through having the maximum amount of supply and the maximum points of distribution right across our state. Because Victorians know that when we get to that 80% figure, that we will have greater options to return to a COVID-safe world in which lockdowns and the sort of harsh measures that we're having to put in place at the moment to protect us all and to protect our health system become a thing of the past, and that the goal of driving down infection rates and driving up vaccination rates are the key to getting us to that.
So just to clarify, what you're saying is it's not at 70%, as was agreed at National Cabinet, it's at 80% that Victoria will open up?
I'm not saying that at all. The National Cabinet position, based on the Doherty Institute modelling, is 70% gives you a whole heap of options, 80% gives you a whole heap more.
So will Victoria open up at 70% vaccination rate?
Victoria will follow the National Cabinet plan as the Premier indicated yesterday, which is the Doherty modelling underpinning, driving down infection rates and driving up vaccination rates.
Just one last point. Given that the priority is to hit our state vaccination targets, and there are these thousands and thousands of appointments that are available right now that aren't being taken up, why aren't we opening that up to the thousands of young people who would take them up?
As supply comes in, we throw it into the system. As more supply becomes available, we open up more spots. As I've just indicated, we've seen really strong demand over the past week. We want to generate more demand, which is why targeting the public sector workforce, which we have direct influence over, and whilst we're working with the Commonwealth about making sure that their responsibility of key groups such as disability workforce and private residential aged care workers are a priority. But there's plenty of other groups who can come forward right across the state to come forward and do their bit. In regards to the process that the Prime Minister indicated of everyone over 16 having the opportunity post the 30th of August, of course, we're working with General Fruin and his team about making sure that that committed supply is there, and we will be working really hard to make sure that that supply is there and that it's out the door and into arms as quickly as possible.
So why do we still have people in Category 1A of the federal rollout who are unvaccinated?
Well, you'd have to ask the Prime Minister that.
But in terms of our state-run aged care facilities and disability services, why are we not at 100%?
Well, we don't run state disability services. That's called the National Disability Insurance Scheme.
In terms of aged care?
And the Commonwealth are responsible. We are well over 80% in our public residential aged care workforce vaccination rates, much, much higher than the private residential aged care workforce. And I'm confident that now that we have this final call for the finish line of the 17th of September under the National Cabinet deadline, that we will get there in the area that we're responsible for. We, of course, if you work in private residential aged care in Victoria, even though you are regulated and the Commonwealth have indicated that that was going to be their responsibility in the 1A, 1B area, which was going to be done by Easter, if we all cast our mind back, it still hasn't been done by the Commonwealth. We've lent assistance in the past and we're lending assistance again because we're talking about the Victorian community who needs to be protected here.
So how many of our healthcare workers are still unvaccinated?
I don't have that exact figure, but it's well into the 80s, if not 90s.
Just on that,
I can get that to you.
In terms of public health, public sector employees, I think you said of roughly 300,000, but how many are there? How many do you believe need to be vaccinated or get a second dose? And how much do you think this scheme is going to cost us?
My friend, the Treasurer and the Minister for Industrial Relations will be able to answer the last question as to cost, so we'll get that. But we don't think it's a cost because what we think... How much will... Well,
what's a ballpark that you think is going to cost?
What we think is that given the available opportunities and the fact that seeking leave, up to half a day's leave, is an investment in making sure that all of the services that our public sector agencies deliver will be protected as the wider Victorian community will be protected. In terms of the specific groups, each department has been doing its own work and that will vary. Obviously, Victoria Police, our healthcare agencies, our frontline emergency responders, Fire Rescue Victoria, they've been in some of the priority groups for quite some time and are at quite high levels. Other areas, water authorities, teachers, school communities, they'll be at a different level. So each sector will vary, But what this is a call to say is, as increasingly supply becomes less of an issue, it's still an issue, but as it becomes less of an issue, we want to do, as other private sector employers are doing, is assist as many people as possible to make it as easy as possible to come forward and get a vaccination.
So roughly how big is that public sector workforce?
Well, it's about 300,000, but we can get you the specific breakdown if you like.
And the amount of aged care and disability workers, I think you said about 80%.
Over 80% of the public residential aged care workforce. So Victoria is unique, in fact, in having a substantial public sector residential aged care service. Just about everywhere else in the country, it's exclusively privately run and therefore regulated by the Commonwealth. In Victoria, the majority continues to be private residential aged care. We run about 8 to 10% of the sector, and our figures of vaccination are quite high.
So the 20% of those unvaccinated, how many people is that?
I can get to those exact figures. My friend, the Minister for Aged Care Services, has been working diligently with all of our public residential aged care providers and the private residential aged care providers to drive up those figures, but we can get you those.
Given we've seen
we will ask the Commonwealth, but do you know how many unvaccinated staff there are in the private aged care facilities at the moment?
I understand the Commonwealth have provided as a part of, it varies across states, but you'd have to ask the Commonwealth, but my understanding is that it's pushing the 50%, but I wouldn't want to be
one dose or two.
Can I just ask, on the Royal Melbourne Hospital, how long was that man infectious on the rehab ward before the case was detected?
I don't know. I'm not sure if Kate knows. Yeah, Kate's got some more details on that.
Yes, with respect to the Royal Melbourne Hospital, the Minister's correct that the gentleman who was having surgery is not the index case. And the index case is the first case we find. That can be sometimes the source case, sometimes it isn't. The index case we found was a visitor to Royal Melbourne Hospital. She started experiencing symptoms and she went and got tested, and we thank her for doing so. She was visiting a family member who shared a room with the gentleman who we believe is our source case. The source case, the gentleman who had undergone surgery on the 12th of August, he was originally from Shepparton, which of course at that point in time we weren't aware of any community transmission in Shepparton dating back to the 12th of August. So he has been on a ward and in and out various parts of Royal Melbourne Hospital, appropriately, radiology, the intensive care unit, and of course the cardiac ward that he was recovering on. So the period of concern at the Royal Melbourne does date back to the 12th of August.
And so which wards are exposed?
I'm not going to get into details of the wards. I'll leave that detail to the hospital to conduct its contact tracing, but we're working very closely with the Royal Melbourne to be able to identify primary close contacts related to that outbreak.
And he went back to Shepparton.
No, my current understanding, well, I can confirm it, is that the gentleman is still in hospital.
Okay, so he wasn't the source case for the Shepparton outbreak?
We don't have a source case for the Shepparton outbreak yet. We're not sure how that outbreak started. It could well be a new incursion from New South Wales. It may be something else we don't yet know.
And how many staff are furloughed in relation to the Royal Melbourne Hospital?
I don't have an exact number. They're still working through that, but the number will be in the hundreds.
How many cases all up linked to that Royal Melbourne cluster now?
Okay, so I'm currently aware of 7, as I mentioned before, one of which we discussed yesterday. 3 are in today's numbers and 3 will be in tomorrow's numbers at this stage, although we do expect that number may unfortunately grow.
Just on the industrial site in Sunshine West, do you know approximately how many people work there? And of those, how many have been tested? And have you also considered maybe going door to door and testing everyone or almost everyone?
We're working very closely with the businesses in that sort of rectangular area. Unfortunately, I don't have the streets in my head. I'm aware there's about 120 businesses in the area of concern in that water catchment that we have tested. We have been working directly with each of those businesses to get their employee lists and to work with them to get tested. A couple of the larger employers in that area, for instance, instance, are Transdev, the bus company, and Australia Post has a distribution centre there as well. I don't have the exact numbers to hand of how many employees we've been able to get tested in that cohort, but we'll be able to get you that information.
Just back on the staff being furloughed, with hundreds of staff furloughed at RMH, you've got at least 50 at Werribee, still some at Footscray. How's the system going overall? That sounds like a lot of people off work.
Look, we're obviously working very closely with each of our health systems, and we're looking at emergency staffing as well. So we'll be doing that to ensure that we can, maintain the health system over coming days. I'm confident that we've got the contingency plans in place to be able to keep that going.
What does emergency staffing mean? Does that mean bringing in staff from other states or student nurses? What does that mean?
I don't have that detail. I wonder if Minister Fobley. Yep.
Sure. The woman who visited family at RMH, who was the index case, do we know where she's contracted coronavirus from? Or what suburb she comes from?
No, we believe it. So this is a sort of an epidemiological thing, if I can. Index case is the first case we find in an outbreak. It's different to sourced case, sometimes maybe source case. So source is the person who sort of brought it into that setting. Index is the first one we find. So that visitor was the index case. Our current understanding is that she contracted it from her family member that she was visiting, who had contracted it from the source case, the gentleman from Shepparton who is sharing a room with that woman.
So you think he was the one infectious first?
That's our current understanding.
So are you working on the assumption that he may have brought the virus from Shepparton to the Royal Melbourne Hospital?
That is our current belief. Of course, we have not been able to epidemiologically link that back to the Shepparton outbreak yet, but that is our current understanding based on symptom onset dates in that cluster.
Was he one of those members of those multiple families that Jerome mentioned, or is this far greater than those 3 families now?
Well, we don't know yet. We're still working on the acquisition source of the Shepparton outbreak. As we know, it has moved through a number of families and it has moved into school transmission as well.
And so was the gentleman tested after the visitor was tested, or was he tested before the surgery? Because it sounds like he was actually, on the ward and moving around the hospital for a while before he was tested.
Right, that's correct. He was tested after the visitor was tested. At that point in time, there wasn't a known risk in Shepparton. So at that point in time, there was no reason to necessarily test that gentleman prior to his surgery. We are now working with our health system to reintroduce pre-operative testing, given the community transmission.
The vast majority of today's cases, they're linked to current outbreaks, but they've also been out in the community. If they were primary or secondary were they primary and secondary close contacts already identified? And how can we have so many contacts who are not in isolation?
So as I mentioned earlier, we are absolutely getting on top of this. 44 of the 65 cases that were announced today were primary close contacts. However, that doesn't necessarily equate at this stage in an outbreak, as we find new outbreaks, to being in isolation. The Royal Melbourne is a really good example of that. Shepparton is another good example of that. Those outbreaks became known to us within the past 24, 48 hours. So, of course, the primary close contacts that we've been able to track down, the rings of rings, have not necessarily yet been in isolation during their infectious periods.
Just on the Werribee, are there any more
chasing our tails here, given that it's only 24 to 48 hours that we pick up the primary close contacts and then get them in isolation?
I'm sorry, can you start again?
Sorry. Are we chasing our tails here, given that we only have about 24, 48 hours between when a primary close contact is identified and then putting them into isolation? Surely you'd like to have a lot more leeway there.
That's not how I would characterise it. We've made it quite clear in the past that as we find cases, we get on top of it, we close it down, we close down the downstream transmission. We need people to come forward, please, as soon as you experience symptoms and get tested so that our teams can do exactly that. We're doing that in Shepparton, we're doing it with the Royal Melbourne, and we'll continue to do it if we find new outbreaks.
Okay, even if you remove the 20-odd cases from Shepparton and the 3 that you've currently linked to the Royal Melbourne Hospital, there are still roughly 30 who weren't in isolation. If they're still linked, I mean, where is this transmission occurring? Is it still within the homes? Are these people that are not necessarily following the rules? How is this happening? Or are they just simply not giving you the details of these people when you interview other positive cases because they know that they've broken the rules? Like, where's the breakdown to result in 30-odd people being out and about?
I don't have that full breakdown with me. It can be due to various matters. So as mentioned, we've got 21 linked to Greater Shepparton. We only found out about that recently. My centre, Broadmeadows, again, is bringing up new cases. So while I don't have a breakdown today of which people were, identified when, if you will, to be able to get into that, isolated during an infectious period, again, I'll repeat the call to everyone. As you get symptoms, please come forward to get tested. Please minimise your transmission so that we can stop the spread.
On that, the Police Chief Commissioner said today that they had the most calls they've ever had yesterday to their line, 3,000, 2,000 were for private gatherings. Is that still the main driver, these illegal gatherings?
I'm not aware of any illegal gatherings in this set of numbers that I'm announcing today.
Given that you now have community transmission and transmission at the Royal Melbourne Hospital, who from all accounts that I've heard have handled it quite well, is there more that needs to be done to protect healthcare workers from it getting into the healthcare system? Like you mentioned, pre-operative testing, is that widespread now? Can there be more done, like using fit-tested N95 masks at more settings rather than just in COVID wards?
No, all our front-facing staff are in Tier 3 PPE. So in the EDs, in the ICU, as well as in the COVID wards, they are already in Tier 3 PPE. So that also helps with the numbers of people that we furlough if COVID does present at a hospital setting in order to maintain those healthcare systems.
And are there any more cases associated with the Werribee Mercy Hospital?
I don't have that number to hand. We can get you that.
We're hovering about the 40 to 50,000 test mark for a number of days now. Are you comfortable with that level of testing? And are you comfortable with the level of testing in regional Victoria as well?
I don't have the split with me in terms of our test numbers throughout regional Victoria. Obviously, there's been increased demand in Shepparton since we've found the Shepparton outbreak over the last couple of days. And again, I thank the people of Shepparton for coming forward. I know there's some wait times, but getting tested is a priority. Again, we'd like those people who've attended exposure sites, and in Shepparton particularly, if you're related to those school communities, if you've been online and seen that you've been one of those exposure sites, we ask you to come forward. If you don't have those concerns, please wait until demand subsides a little bit, and then if you are still concerned, please go and get tested. But we ask that the testing capacity, especially in Shepparton at the moment, is maintained and prioritised for those with symptoms as well as those who are related to the current outbreaks or exposure sites.
Just for clarity, are you saying you're looking at getting everyone that comes into a hospital, whether that be a patient or a visitor, to get a COVID test when they arrive?
No, that's not what I've said. Certainly pre-operative testing is one area we're looking at. We had it last year in 2020 when we had significant community transmission. We did ask anyone entering hospital for a medical procedure to get a test, I think, within 72 hours before presenting for that surgery, and we're looking at getting that system back in place now.
And should we expect further tightening on visitors? I know the RMH is already not taking visitors. Will that happen elsewhere as well?
Certainly we will be looking at all options on the table to help ensure that there is no further transmission in our healthcare settings.
Should visitors be tested? Should visitors be tested when they come into a hospital?
Look, I think the numbers of visitors approaching our healthcare systems is reducing and being minimised, and we'll be looking at those settings as well.
Is there a place for rapid antigen testing in high-risk settings like schools, childcare centres, hospitals, where people are going in for surgery and then coming out with COVID-19?
We are looking at how rapid antigen testing may be useful in certain settings. However, it is not the gold standard test. The sensitivity of rapid antigen is nowhere near it is of the PCR tests. We still have good capacity in our system. As mentioned, we're sitting at 40 to 50,000 tests a day, and our turnaround times are still 90%, returning a test result the next day. Our system is holding up really well, so we will still be prioritising the gold standard of the PCR test.
There are reports, though, that the Werribee Mercy Hospital over the last few days, that patient who was COVID-19 positive arrived in an ambulance and refused to wear a mask. It's all well and good to say that PCR tests are coming back within 24 hours, but that doesn't help in that high-risk setting of a hospital at that moment when somebody is COVID positive.
Hospitals do have access to gene expert platforms. They are used more than the regular pathology machines, if I can call it that, and I'm not a pathologist, so please excuse my terminology. But the gene expert platform can return a test within 60 to 90 minutes, and they're used a lot with suspected COVID patients who arrive at hospital settings.
On that Werribee Mercy case, Jerome yesterday said there were some complexities around it. We've heard those reports that the man refused to wear a mask. Can you shed any light on what happened there?
I haven't heard that, so I can look into the details, but I don't have any further details on that Werribee Mercy admission at this point.
Would we have capacity to test visitors coming to hospitals, or would that be a mammoth task?
Again, we do need to prioritise our testing capacity for the biggest bang for buck, if you will. Symptoms, people who've been exposed to known COVID cases, people who've been at Tier 1 exposure sites. So we will look at all the different options to ensure that we minimise spread, but our testing capacity does need to be prioritised.
Can I ask the Minister a question? Good question, Minister Foley, if that's okay. Can you understand the frustration? There are Victorian parents who are being told that they will need to take annual leave from work in order to care for their children who can no longer attend childcare, and yet a COVID-19 positive person was admitted to the Royal Melbourne Hospital from Shepparton for surgery. Can you understand the frustration there that these restrictions are growing tighter and tighter, and yet something seemingly obvious, like a COVID-19 positive case in a public hospital, goes undetected?
I'm not sure there is a direct equivalence.
The frustration is the question. Can you understand the community frustration?
I can certainly understand the frustration of millions of Victorians who are knuckling down, as they have on a number of occasions, to get us through this outbreak. We've seen a significant number of cases in kids under 9, I think a quarter of the current cases. We've seen childcare centres and early childhood education centres as points of transmission. We can't take that risk knowingly to put our kids in harm's way. That's why the public health orders, as tough as they are about protecting those kids. And I have nothing but huge admiration and support and sympathy for all of those parents and carers who are providing that frontline home care support now, whilst at the same time dealing with the tribulations of the wider restrictions. I can totally get the frustrations, but what I can also get is the concern of parents whose kids are sick. And what we've seen, that COVID-19, when it comes to young people, particularly that age, they're not eligible for a vaccine. We don't know what the impact of COVID is long-term on them, and we need to take every step that the public health team recommend to us to protect especially our kids.
Well, has our health system dropped the ball here?
No, not at all. There's no evidence that that's the case. What we've done is built on all the learnings of the last 18 months, and the Royal Melbourne, as has I think been indicated, has responded in a pretty good way. And I want to thank all of our frontline healthcare workers. Our healthcare system is already running at maximum capacity before the global pandemic. They've stood up to a whole new level of demand since then in really, really extreme conditions. Level 3 PPE, increased infection prevention and control measures, all are there to protect our frontline healthcare workers and to make sure that our patients and our wider community get the care for COVID and any other reason that you would need to get support from our healthcare system.
Can you
I want to thank them for our work.
You said that we've learnt from last year, but pre-operative testing wasn't being used.
Well, pre-operative testing, there's a series now of graduated responses that all of our healthcare system have in place in regards to the risk settings that apply across our healthcare system. And the system that the Royal Melbourne had in place, that Werribee had in place, was linked directly to those systems. It was at a heightened level. Now it's at an even higher level. And it can go even higher if it needs to. And in regards to that, I think the Royal Melbourne and Western and Mansfield and Goulburn Valley and our entire healthcare system are responding admirably, and I want to thank them for their great efforts.
Well, the question is not have the individual hospitals dropped the ball. The question is, in following the health advice, has the health advice itself been too lax?
No, we worked through all of these, what the risk-based settings were with our healthcare system. It was based on the evidence and the learnings and the evolution of the pandemic, both here in Australia and globally, around all sorts of issues, including the variants of concern, issues as to which locations were best able to treat COVID patients, measures for infection prevention and control, measures around ventilation, heating and air conditioning. A whole range of factors have gone into how can we put in place the safest possible system, the lowest risk system. But as we've said throughout this whole awful global pandemic, no system is risk-free. And what we have to put in place is the best possible system that protects our frontline healthcare workers and our patients. And that is why we have, amongst other things, the statewide restriction measures in place.
Were those measures adjusted for the Delta strain of coronavirus?
I beg your pardon?
Were those measures adjusted for the Delta strain?
They were. All the variants of concern have fed into that, whether it be the Alpha, Delta and other factors, air conditioning, all of those levels of risk are constantly reassessed.
So if we're not doing today's new COVID cases,
I beg your pardon?
a majority of today's new COVID cases weren't in isolation while they were infectious.
That's right.
This lockdown, it's due to end in about a week and a half. Is it time that we're more honest with Victorians about the fact that this is not ending anytime soon?
Well, the premise of your question is the first thing that I'd take issue with. We are upfront and honest with Victorians every day of the week by providing transparent information in the most timely way we can. As Kate indicated before, when you look at the evolution of this particular outbreak, some of the earlier parts of the outbreak, whilst not closed down totally, are pretty well managed. The fact that we've got a high number proportionately of cases out in the community today, in the numbers that we've released, reflects the fact that we've got new components for that outbreak. And as we've indicated, every step of the way, we will provide up-to-date, transparent information to the Victorian people as soon as we get it.
Do you believe that we're on track to lift lockdown in a week and a half?
Well, as we say, every day is a day-by-day assessment and a day-by-day reassessment of where we're at. A day is a very long time in a global pandemic. The best part of 2 weeks is almost an eternity.
Have you done any forward projections of, given the lay of the land of the outbreak now and all the different clusters, whether we can get
Well,
that
I'm not an
brought down in a week
epidemiologist,
and a
but
half?
our advice is that doing the things we do, bringing the amount of tools of the restriction measures, the infection prevention and control measures, the contact tracing and isolation work, and the vaccination programs are all part of the rich mix of factors that give our public health team and the wider Victorian community the certainty that we can get on top of this and drive down infection rates whilst driving up vaccination rates to make sure that we get ahead of this.
Minister, back to the Royal Melbourne case. If we're not announcing pre-operative testing today, how can you give the public assurances
I've indicated
this
that
won't
as
happen
part
again?
of the on pre-operative testing as part of the ratcheting up of measures. My advice is that the Royal Melbourne and other particular trauma and frontline services are in fact doing precisely that.
But is that the directive, or is that at the discretion of the hospital doctor, staff member on shift?
It's not at discretion. There's a risk-based system that the health networks have all designed and signed up to, and it's system-wide approach.
But this man clearly fell through the cracks. He was from an area where an outbreak was that we didn't yet know about. So wouldn't it be beneficial now to make it across the board, that pre-operative
I just indicated
testing?
it's a system-wide response.
Just back on childcare, yesterday the Premier had said that the childcare restrictions will reflect what happened last year. There were two different settings last year. For a very brief window, both parents needed to be authorised workers, and then for the vast majority of the restriction period, only one parent needed to be an authorised worker. What's the setting currently in place?
Rather than speculate, let me lock it in precisely, but my understanding is it's the latter, that it's the one parent, but let me for the sake of certainty, just get back to you about that. It was the system that was in place in 2020, but I'm pretty sure it was the latter. But let's confirm that.
Will childcare providers be sending kids back? I know in New South Wales they've obviously closed down schools, but the Premier there had said, for example, no child will be turned away. Will children be turned away from childcare facilities?
Well, it'll be a permit-based system, so that the qualification will be if you're an authorised or permitted worker.
And for the vulnerable children?
Yeah, well, that, as what each of those communities have pretty good relationships with their families, and I'm sure that all the eligible kids, which is a substantially reduced number, will be looked after, and that's because we've seen 25% of this particular outbreak being kids under 9, and we've seen a number of examples, including one quite large one, of early childhood education and childcare centres being a location of transmission.
I've got no crystal ball, but just in terms of when we do begin to ease restrictions, do you foresee that childcare restrictions will be or potentially could be lifted much sooner than other restrictions?
It's too early to speculate.
And then is there also on education in New South Wales, they're looking at as a contingency sitting the HSC exams outside. Are we making further contingency plans in case we're still in lockdown when we get
I'd refer you to
exams?
some public comments the Minister for Education made on Friday, including a media release going to those details, so I'd refer you to that.
Back to Mark's earlier point on vaccinations, are there any added measures the government is doing or could consider to get some of these older Victorians that aren't vaccinated over the line, like door knocking, phone calls?
Firstly, increasingly we're seeing pretty good numbers in the senior age groups when it comes to vaccines through all sorts of targeted efforts. I'm sure that we will work with stakeholder groups, representatives of those communities. There's no one thing when it comes to any age group in Victoria. We're a diverse community, and as we increasingly look to those older groups as to the last, if you like, it's more than mopping up, but the last numbers in each of those groups, that we'll target arrangements, whether it be through culturally and linguistically diverse communities, regional communities, particular interest groups. I'm sure there's a range of things that our vaccination programs, as well as Victorians themselves, are coming forward with all sorts of ideas as to how we can engage positively to get people vaccinated.
Minister, did you see the Prime Minister's interview on the ABC this morning?
No, I didn't.
He said that, and I'm just going to quote so I get this 100% right, I think that it's highly unlikely we get to zero, but that's really not the point. Right now, of course, we need to make sure the lockdowns are effective. We need to suppress the virus as best we can. But he's clearly saying that zero is not likely, particularly in New South Wales. Do you still believe it's likely in Victoria?
Well, as the Premier, when he was asked this yesterday, National Cabinet has, again, as I'm advised, recommitted to the national strategy. And the national strategy is predicated on active suppression. And it's not necessarily a literal interpretation of zero, it's the story behind those cases. But as close to or down to those Doherty-based models, numbers that give you the options when you hit 70% and 80%, Victoria, the nation, all levels of the Commonwealth and state government have signed up to that arrangement, and that's the plan.
But in terms of the picture that we're painting for our future, yesterday Gladys Berejiklian said even though we've got 825 cases, we're seeing fewer people in hospital and fewer people dying. Dr Nick Coatsworth said yesterday that with the current rate of vaccination that we're going to see fewer people in hospital as we continue to go forward. But yesterday when Daniel Andrews was asked about hitting 70 and 80%, he said even if we get to that point and we don't reduce numbers, our hospitals will look like a war zone. So what is the picture we're painting here? Because we're hearing two very different things.
No, I don't think... Well, I can't speak for the New South Wales government. And
Dr.
Dr Coatsworth is a former public health official, and I'm sure his contribution is valuable, but I don't speak for the New South Wales government. I think the point is that if this gets away from us, as it clearly has in New South Wales, I'm pretty sure their public health system is under a whole lot more strain than ours. and they're still some way from 70 and 80%. And to throw open doors for relaxation of measures with those levels of infectivity in the community is going to overrun any state or jurisdiction's healthcare system in the current form. So the Premier was spot on. Victoria, every state and territory and the Commonwealth has signed up to the national plan, and any suggestion to the contrary is one that Victoria rejects.
But just to be clear, I'm not saying to reduce measures. I'm just saying in terms of the picture that we're painting once we hit 70% and beyond to 80% and even beyond that. So what is the reality that we're facing on the hospital?
I refer you to the national plan, which the Prime Minister has released, which all states have signed up to. It's based on low levels of infectivity and high rates of vaccination. That's the national plan, and any suggestion to the contrary is not correct.
You talk about this getting away from officials in New South Wales. What we've heard this morning is that it's got away from us right here in Victoria inside a public hospital. Can you say to Victorian people,
that's your interpretation.
Well, can you say to the... Well, here's the first question. Had that patient from Shepparton been tested for COVID-19 pre-surgery, would there have been a COVID-19 outbreak at the Royal Melbourne Hospital?
Well, I can't say that because I don't have the epidemiological link as to how that person acquired COVID-19. That is being investigated as we speak. There's all sorts of contact tracing work being done. So in regards to the substantive question, which I took to be, where are we? I don't want to have any cases in our community, but we know that with particular Delta, it is highly infectious and moves really fast. That is why we have in place the public health measures and restrictions that allow our contact tracers and our public health team to identify and respond to measures. And they're tough restrictions, unfortunately, because they have to be, so as to give our contact tracers, our public health officials and others that ability to identify and close down outbreaks as we identify them. The opportunity of the prospects of doing that at 800 or 1,000 a day become quite challenging, and the impact when that happens in a community that still has substantial numbers of people unvaccinated is a real public health challenge that will see a lot of people get sick and a lot of people die.
Of course, we all hope contact tracers win this one, but I'm just asking you to have a look at the reality. We're more than 2 weeks into this pretty tough lockdown,
yes,
and cases infectious in the community continue to grow. They have been so for the last couple of days. And we had 2,000 calls to the police helpline yesterday for illegal private gatherings. So is this lockdown working?
Well, this lockdown is in place to the 2nd of September, and all the advice that we have from our public health officials is that provided we all follow the rules and that we all stick...
the rules.
Well, I think overwhelmingly Victorians are. You're quite right. Victoria Police have had increasing number of incidents reported to them, and I thank those Victoria Police for acting on those. And can I also take this as an opportunity to thank all of those Victorian Police who put themselves on the line yesterday, and send my best wishes to those injured Victoria Police from the completely outrageous attack that was run on them yesterday at what was supposedly a freedom rally. Nothing could be more inappropriately tagged ever. But in regards to the particular issue you raise, the public health advice continues to be that a combination of measures of good compliance, quick public health responses and people following the rules will see us get on top of this. It's in all of our hands. It's up to us all to respond in a way that drives down those infections and at the same time drives up the vaccinations. It's not one or the other.
Can you just say what work is being done on a code of conduct for ventilation?
Yes, Victoria has called upon, so building standards are regulated nationally in this country. The learnings that Victoria, in particular, through air conditioning, heating and ventilation in healthcare settings, has been shared first and foremost with all of our healthcare settings and with other jurisdictions. So those learnings about how airborne transmission has occurred can be factored into our public health response. In Victoria, that has fed into that system of essentially streaming which hospitals and which locations in hospitals are best set for treating COVID patients. And our Victorian Health Building Authority has already commenced, is well down the track, of implementing a substantial range of measures to make sure that those facilities are brought up to standard. Having said that, it's barely scratching the surface of the work that needs to be done nationally, and Victoria strongly supports the calls for the Commonwealth to take a greater lead in this space, given that the building regulations are a national regulated area.
What was your reaction to those violent scenes we saw? What was your reaction to the violent scenes that we saw yesterday?
Well, I was horrified, like all Victorians, that supposedly an event that was there to express concerns about the lockdown is essentially running the risk of prolonging the lockdown. As our frontline healthcare professionals have pointed out, that runs the risk of becoming a super spreader event. What more counterproductive time could you spend to do that, and then at the same time launch what the Chief Commissioner has described as the most violent attack on police in 20 years. And I condemn those people who attacked Victoria Police, and I support totally, as I'm sure all Victorians do, the full weight of the law to be brought upon those people who attacked our Victorian Police frontline workers.
Can I ask Martin Pakula a question?
You sure can.
I just wanted to know on childcare again, that there are many childcare businesses across Victoria who would, the federal government said last night that they would do the fee waive thing that they did last year, but obviously last year there were a lot of other supports in place that are not necessarily in place this year. Are they eligible for the state government support at all?
Well, they'll be eligible for one or other of the packages. So I don't have the codes in front of me, but if they're not eligible for the Business Cost Assistance Program, then they would conceivably be eligible for the Small Business Hardship Fund. But you're right, last year there was, I think, a specific Commonwealth package in place for childcare businesses, and it may well be that the Commonwealth needs to give consideration to something of that nature again.
How good is the grand final going to be in Perth?
For starters, I don't think it's good that you guys all have chairs, by the way. Look, the grand final is clearly very challenging. We've got this current lockdown runs till September 2. The grand final scheduled, I think, for September 25. And I think it probably goes without saying that right now it looks problematic. The idea that we would have tens of thousands of people gathered in one place that soon. Having said that, contrary to reports, we haven't waved the white flag yet, but I am in constant discussion with Gillan and the team at the AFL. Look, the government will, as well as doing what's best for Victoria, we're also keenly interested in the health of the code and what's best for football. We would never seek to force the AFL to play the grand final in front of an empty stadium. We didn't do that last year, and we won't do that this year. So I'm not in a position to make any announcements about the grand final today, but rest assured we're talking to the AFL pretty regularly.
When do we? I was going to say when do we wave the white flag?
Well, you're assuming that we will, and I'm not prepared to make that assumption. Look, I think, what I've indicated broadly to the AFL is at the end of this current lockdown period, so around early September, we'll see where we are, and we'll have a grown-up conversation with them about that then.
Sorry, Minister, just one more. Many round 2 applications from a few lockdowns ago who applied at the start of August, still haven't heard if they're eligible yet. What advice would you give to them?
Well, are you talking about business cost assistance program?
For the round two, for the people that didn't apply for the May?
Yeah, well, I would say to you that thousands and thousands have. So just to put that in some context, and don't hold me to these numbers, I think in the early days of the business cost assistance program, we were assuming about 86,000 eligible applicants. I think in this most recent round, we're more at about 112,000. So that would suggest there's been some 25 odd thousand at least who've come in as a result of those additional applications, and some may have registered for GST in the interim. So, it's similar to what I've said in the past, which is that if there are delays, it's generally a result of there being some complexity about the case, whether it's non-matching ABN numbers, ASIC codes, and things of that nature. But there has been a substantial growth in the number of businesses eligible for the BCAP and being paid automatically now, and that's in addition to the 18,000 that are being assumed for the Small Business Hardship Fund. And I can say in relation to that fund, I think there's been, which is the fund administered by Minister Pulford, there's been some 10 or 11,000 applications received already. So, look, the most significant part of our payment process is the automatic nature of it. All of the payments that I've announced today are automatic payments. All of the payments that we announced on Thursday for the metropolitan area are automatic payments, with the exception of the Small Business Hardship Fund. And we are getting money out the door. I mean, I think since the May-June lockdown commenced, we've got almost $2 billion of payments into people's accounts. I remind businesses that once the payments are approved, it can take up to 5 days to hit the account, depending on the financial institution you're with. But our team at Business Victoria are working like around the clock getting these complex ones resolved, but just hitting go on the non-complex ones and getting money into businesses' accounts very quickly.
I appreciate it's at least 4 months away, but has the government turned its attention to the Australian Open, and what could that potentially look like? Do we have any contingencies in place? Is Australian Open willing to do 2 weeks quarantine again?
Well, look, the Australian Open, as you rightly indicate, it's actually more like 5 months away, if my maths is right. And we have, based on the trajectory of the vaccination program, we think we'll be well beyond the 80% vaccination levels by then. And so under the national plan, that means all manner of additional, not just additional freedoms, but it means, different arrangements for people who enter the country and things of that nature. So all of that's being factored into the discussions that we're having with Tennis Australia. I'm not in a position to, talk in detail about what arrangements might be in place, but fair to say that we are progressing our discussions with TA based on assumptions about where our vaccination programs will be at, and with the sort of take-up that we're having at the moment. I mean, I recall when we postponed the Formula One Grand Prix, making the point that I think at that stage we were at 9% 2-dose vax, and I think tomorrow when we stand up, we'll be at 30. So, we are really starting to motor, and I think that's a really important takeaway, for all of the legitimate frustration of lockdown. And it's not just frustration, but, the distress it's causing to business. We are really starting to hit those vaccination targets, and we can look forward to a different summer, and those events coming back, but we've just got to keep going and getting those jabs in our arms.
We've never actually heard about the assumptions. Do you know, when are you assuming we're going to get to 80%?
Well, I think if you just the assumptions, you see them reported in online all the time. I mean, based on the current trajectory, I think
it's going to slow down in terms of demand at some point, or do you think we're just going to skyrocket to 80?
Well, I would hope that people understand the absolute benefits that accrue, not just to them and their own personal health, but to the community more generally from going and getting vaccinated. So, I think we're seeing at the moment the 2-dose vaccination rate is growing by between 4 and 5% a week, and you've just got to extrapolate that out. And we would expect, and the Prime Minister's been clear about this, we would expect to hit those numbers before the end of the year.
Can I just ask about your tweet to Jeff Kennett? What did you make of his comments on, I think, Friday night?
Well, I think my tweet spoke for itself, Mitch. Look, I have always, pretty much always, not always, but pretty much always resisted getting into Twitter exchanges with Mr. Kennett. But you know, the fact is that sometimes someone who's been in a position of authority and who has quite a megaphone can say something that's so, I think, so damaging that it just warrants a response. And the fact is, Mr. Kennett tweeted something that was untrue, that was alarmist, and which I think caused a lot of distress to a lot of people. And I thought it warranted a response, and you saw my response. And I think my response was not just warranted, but based on the feedback I got, it actually gave a lot of comfort to people because, you know, what he'd claimed was very upsetting to a lot of people, and it wasn't right, and it needed to be dealt with.
Well done.
Thank you.